to
These
reduce.
are cases done in under Unit 2, sir. Ramlamma, 65-year-old female, came with intertrochanteric fracture of right femur. Type 2. Boyds and Griffiths type 2. These are the preoperative CM pictures. So this is intraop. That good intraop. Intraop is. That's also intraop on this.
After an attempt is made for reduction. Why in the first X-ray, the casualty X-ray, that was in a very good position, with traction, internal rotation. It was almost anatomically reduced.
The fracture had lateral in late.
Why it has been very, generally we don't see this scenario.
Yes.
Why it has happened?
They are spoiled by manipulating it.
Undue traction, excessive traction.
Or handling patient, when you feel the patient to be spouse.
Closed reduction, internal fixation with proximal femoral nail for right femoral.
What was done? What was the difficulty? How it was reduced?
We used a spike
You were
to.
there?
Yes, sir.
You should have told that.
We used a
What
spike.
happened to the displacement?
Displacement.
Go back. What are the displacements here?
The proximal.
Study these things.
Sir.
Not simply. You find it. What happened to the fracture? What are the displacements?
Proximal fragment goes into flexion. Flexion.
So, AP view, there is excessive traction, there is distraction. So, there is distraction. And tops are where? Okay? Yes. Lateral view.
This is the lateral.
The top one is the anterior.
Anterior. This is posterior.
That is flexed.
Proximal fragment is in flexion.
Flexed and there is a little convolution. Greater trochanter also is manipulated. Okay. How was it manipulated? By closed method or open?
Open methods.
Open method.
We used a spike.
So you pass the spike under the
Calcar.
AP.
This is APC. This is lateral.
That is lateral. Yes. Actually, I think that true lateral causes.
Making walk?
No, sir.
When?
6 weeks.
6 months.
6 weeks.
Right?
In such cases, when there was no good lateral column support, trochanteric plate, multiple screws, can be ideal. Okay.
Closed reduction with PFN for right femur.
Sir, these cases can be gone with a variable locking compression plate. Go back, madam. Sir, go back. Yeah. Suppose these cases difficult, you can't achieve good anatomical reduction, early weight bearing, better functional results. You can go with the variable angle locking compression plates. Sir, do you advise? No. Nail is better. Yes, sir?
Sometimes
Yes, sir.
we can put, in addition to that,
No.
we can put a trochanteric plate with universal fixation. And one screw, if it can permit, through the plate, into the mechanism. Next.
This is 19 years male, sir. Closed middle third both bone shaft fracture of right legs. There is a butterfly fragment in middle third. So we have introduced guide wire, sir, and introduced nail. So butterfly fragment is distracted. sir.
You did surgery.
Yes, sir.
Then treat conservative or not?
More 3 cortices are involved, sir.
Also, this place, show me the first X-ray.
Displaced more than 20.
AP, like laterally.
Good contact, almost 100% contact.
Suppose you want, what do you do conservative? You apply cast from where?
Conservatively above knee cast.
Abdomen cast. That's not ideal. 90 minutes. It is not an open wound.
No, sir. Closed wound.
So what do you want to surgery for this? What surgery you want to? Wait.
Nail, sir. Nailing.
What day?
Interlocking nail.
For this. Other things are there, which can do. Tents can be applied here.
No, sir.
Okay.
19 years, skeletally mature.
Matured.
This was discussed in the ward, no?
Yes.
I also thought of treating conservatively, and I asked the person, why is it called a butterfly fragment?
You have disturbed the fraction now. Everything comes out. X-ray, final X-ray. In difference here, except the
How was it reduced?
Openly, sir. Open. We are done. Open and done, sir. Bone clamp.
You have opened at the fracture site.
Yes.
So reduce and pass the nail. So what is the length of the nail?
32, sir.
Diameter?
8.
8 diameter. 19 years, 8 diameter.
You know why it got displaced?
By nailing.
Which was in position. Why did it get displaced? The entry point was too medial and it is hitting the lateral cortex. Guide wire might have hit the butterfly fragment.
you would have hold complete fragment and put on cleaver. But still, with more clamp.
On the limb itself, because it is a subcutaneous bone medially over a arm, so that it doesn't hurt the skin. You can still hold it with leg loose. The entry point C, the nail is touching the medial cortex, the proximal part of the tibia, and when it has come to the fracture site, it is touching the lateral cortex.
See, that is the some tissue was there. You opened it.
No, sir.
Circular fragment.
No, no.
No bias,
No.
No attachment.
In
Interposition. Very unlikely, isn't it?
Muscle is very less.
Original X-ray
Tibia is more of subcutaneous bone.
could be treated conservatively also. It's only 19 years.
yes, sir.
19 years.
Very good bone stock, good vascularity. Right.
Early mobilization, prognosis results are better than delayed mobilization. Fracture disease.
36-year male, sir, with 4-year-old status closed right tibial plateau fracture, implant in situ. We have done implant removals.
What are movements possible here? Post-op? You get a full flexion then.
Yes, sir, he is able to. He is doing.
Nothing.
He is doing
He's doing total.
total flexion. Normal, sir.
Yes, sir.
Actually, there was an anterior slope. Tibia. Normally around 3 degrees of posterior slope will be there. Probably something is condylar nature. Okay.
27 years male, 6 years old status closed middle third shaft fracture of right femur with implant in situ high lens. Have done implant.
Good morning, sir. This is the cases done in Unit 3. This is a 30-year-old male with closed lateral malleolar fracture of right ankle, with history of skid and fall from bike, and with a twisting injury and fall of bike directly over the right ankle. This is a superior external rotation type of supination external rotation type of log Hansen classification.
Medial malus is involved, not involved?
There is a small hairline fracture, sir. Transfer small hairline fracture.
Zoom the image, please. Medial malus is involved, not involved?
External rotation, sir. Supination external rotation. So we had an open rotation with the 4-hole fibular plating, sir. This is a there is a spiral injury, sir. Sir, uncommon, sir. Usually they will be associated with a medial malleolar fracture. Yes. This is small hairline fracture, sir. 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 Syndesmotic. Syndesmotic. Fibular ligament. Okay, sir.
Can I go back, sir? So some of the injuries are direct injuries, and some of the injuries are indirect. Do you consider it a direct injury or indirect injury?
He has history, given history as a direct injury, sir.
Direct injury. Hit by what?
Fall of bike over the right ankle.
Yeah, so direct injuries. So sometimes there may be direct injuries or indirect injuries. So direct injuries, by looking into the medial malleus alone, it can be abduction injuries or adduction injuries or isolated fibular fractures. Clean, adi important. Yes, sir. So, yes, sir.
Okay, sir.
So ligamentous injuries are more complicated.
Medial delta ligament.
Show me the Martis view, Dr. Sir. Show me the Martis view. Martis.
Fibular plating.
Sir, show me the Martis view. Santosh Reddy. Martis view, pre-op Martis. Rotational strain. Adi point. So there may be direct injuries, especially in artery and hit. Direct hit. What is a direct hit? Rotated, twisted, rotation. Followed by trauma. Followed by
30-year-old male with 3 months old non-union closed middle third both bone shaft fracture of right forearm, sir. It is the oligotropic non-union. Attempt of callus is seen.
oligotropic.
Yes, sir.
The patient bluffs that it is a 2-day-old injury.
3 months. Huh?
The patient bluffs.
Okay.
It is a 3-day-old injury.
The fracture ends are sclerosed, sir. Yeah. Sclerosed, no, sir. Sir?
Evidence of callus is already seen.
Yes, sir. Yes, sir.
And regional osteoporosis. The margins are not very sharp.
Yes.
Though they are not rounded off, they are not sharp like a fresh fracture.
Yes.
And regional osteoporosis. Fresh fractures
Yes, sir.
don't produce regional osteoporosis.
Is the medullary canal is open or closed up?
Closed.
Peroperative also. You have opened peroperatively
Yes, sir.
with bone grafting.
With bone graft.
Yes, sir.
Open reduction internal fixation with plating for right radius and ulna with bone grafting. Yes, yes. Anterior superior iliac. Sir? Yes. Iliac crest. Iliac crest, sir. Iliac. Cancellous. Cancellous. Yes, sir. No, sir. Not difficult.
You have put a suction drain, no suction drain. No suction drain.
Sir, there is a 53-year-old female with closed middle third distal third junction shaft fracture of right femur, sir. This is a Winkish Hansen type 0 classification. We have done closed reduction internal fixation with ILN for right femur, sir.
Go back. What is the classification?
Winkish Hansen type 0, sir. There is no comminution,
Zero now.
sir.
Zero now. Zero classification on
Yes, sir.
that.
There is no comminution, sir.
So, simple fracture, wedge fracture, comminuted fracture, diaphyseal fracture classification. AO. AO
AO.
diaphyseal.
Yes, sir.
AO diaphyseal classification. Simple. Simple ante transverse or a wedge.
A3, sir.
Wedge
A3
type
type.
fracture. So, wedge ante ఏంటి oblique. ఆ wedge కాదు అక్కడ obliques. Wedge కాదు అక్కడ. Oblique fracture. Transverse fractures or oblique fractures, wedge fractures and comminuted fracture.
OTA
What do you
classification
mean by
A3, sir.
comminuted? It can be a segmental fracture also.
Sir.
Yeah, that is. With comminution is different. So దాంట్లో కాంప్లెక్స్ ఆ కాంప్లెక్స్ లో మెన్షన్ చేస్తాడు. సో వాట్ ఈస్ దట్ కాంప్లెక్స్? ఇట్ కెన్ బి కమ్యూనిటెడ్ మల్టీఫ్రాగ్మెంటరీ ఆర్ ఇట్ కెన్ బి సెగ్మెంట్. ఏవో క్లాసిఫికేషన్ ఫర్ డాఫ్. జీరో లేదు, నో జీరో. జీరోలు అని కొత్త -1లు.
మనం ఏం చేస్తాం? డౌన్లోడ్
These are the cases in Unit 1, sir. 9 years male with 15 days old closed proximal middle third junction shaft fracture of both bone forearm, sir, with no distal neurovascular deficit, sir.
What type of fracture? Zoom the image, sir. Can you zoom the image?
But no, sir. Montice variant. radial head, radial dislocation, sir.
Isolated radial head.
Isolated radial dislocation, sir. Sir?
Fractures can be there in radius and ulna both.
Yes, sir. Both bone.
Is it fresh or old one?
Old ones. 15 days old, sir.
15 years old.
Yes, sir.
So can we expect this to be moving there?
Then it be a variant of montage of fracture dislocation. Variants of montage of fracture
No,
dislocation.
sir.
It can be both bones fracture at the same level, upper third. Can be a variant of montage of fracture dislocation.
We have done close reduction internal fixation with 10, sir.
54-year male with the tendinoculus tear of left ankle, sir.
Why was the nailing done? I don't know.
Interosseous space is collapsed.
Closed, sir. Just slip and while step down into steps, sir.
Is it traumatic, non-traumatic?
Trivial trauma.
Trivial
Closed
trauma.
rupture and
Closed.
not lipotherapy. Next.
Closed.
So it is a degenerative
Degenerate.
leading on to trivial trauma. So already degenerative tendon. Is a
There is
former
no distal
occupation, Dr.
stump,
Is a-
sir.
Dr.
It's a small stump.
Is a farmer, patient is a farmer. Good morning.
Yes, sir, farmer.
Farmer. Adi point. So all points important. అడిగితే చెప్పడం కాదు, చెప్పాలి, చెప్పడంలో మెన్షన్ చేయాలి. Tendinoculus.
Closed tendinoculus rupture, sir.
Go to the first slide. First చెప్పు ఇప్పుడు చెప్పు.
Just ultrasound 2 centimeter away from the insertion, sir. Given. Maybe insertional tendinitis is there.
Okay. That's video. Not playing.
In this around. Yes, sir, able to walk, sir.
Okay.
Yes. Yes, sir.
You don't have the push off.
Yes.
Yes.
There is small distal stump is there, and this is proximal stump, sir. We have done crackwise suturing.
End to end.
Yes, sir. Plantar is there.
End to end suturing.
No, sir. This proximal stump pull out suture is done, sir.
That's what end-to-end repair.
Yes.
No. Okay. Do you know any other types of repair?
Yes, sir.
Without knotless repairs, have you heard?
Kesslers.
Anybody? Without knots, because they can pull, knots can pull, cut through, or they can get stretched. You can use anchors.
Yes. Anchor.
Swivel
Bone
technique.
anchors.
Okay, go on.
This is a 18-year male with fracture neck of right femur. The mode of injury is fall from bike. And this comes under Dalbert classification, trans-cervical. Yes, sir. More often looks like trans-cervical.
18
years.
Yes, sir.
18 years.
18.
Bicysis.
With basal extension, sir. But and also there is a trochanteric extension also, but more often it passes through the neck. So box. Yes.
Is it a trivial injury or a severe injury?
Severe injury, sir.
Severe
Fall
injury.
from it. So We have done ORF with CC screw fixation for the right femur. And while opening, so pre-op, we have tried for lead butter technique.
Oh.
And we didn't get proper reduction, and then we opened it. There is anterior displacement, and then we reduced it to the spike and passed K-wise, and then stabilized it. After getting stabilization, we stabilized it with CC screws, sir.
Lateral view.
Yes.
Happy with the lateral view? Where is it?
It's in the center only.
Is it acceptable or not?
It's acceptable, sir.
Maybe. Little. Look.
Sir.
Mm.
36 years male with closed olecranon fracture of left ulnar, sir.
Mm.
It was Mayo type 2, sir. Type 2B, sir. Comminuted and displaced, sir.
Right.
And intraopics, we have initially stabilized with K-wise, and we have fixed olecranon plate, sir. Not hook plate, sir. Olecranon locking plates.
Contour plate.
Contour plates.
Screw is in the fracture site or what here?
It was comminuted, sir. We have 2 fragments, sir.
Hmm.
Here. So we have fixed with a screw, sir.
Okay, looks good.
(32-year male with closed tibial plateau fracture of the right knee. Here you can see the medial condyle is fractured and displaced, and also involves the posterior cortex of the tibia, sir. This comes under Skarsgård type 4 fracture.
Columns, how many columns are involved?
2 columns, sir. Medial and posterior is involved. These were the CT images. The medial and the posterior column is also involved. So we have done ORF with LCP and LE splitting for the right tibia, sir. LE splitting for the medial support to hold the medial condyle in position, and then we took the support, fixed it with the LCP from the lateral ends. Sir, both sides were open, sir.
2 incisions.
2 incisions were given.
So this is more a posterior medial, isn't it?
Yes, sir.
Plate is posterior medial.
Yes, sir.
Okay.
55-year male, closed volar button fracture of left wrist with fracture dislocation of the 5th proximal phalanx of right hand, sir. This is the left volar button fracture. This is a fracture dislocation is the 5th. We have done open reduction, internal fixation with plating for left radius and K-wire fixation, and for 5th proximal phalanx for right hand. Yes. Yes,
Finger
sir.
was closed?
Yes, sir.
Why another K-wire for the wrist?
For radial styloid.
So not able to hold with the plate.
Yes, sir.
Variable angle plate.
Yes.
That can engage the radial styloid also. Not available.
Distal radial plate, yes.
Now Indian version also will go. You can adjust for the ring fractures also. Column construct. Distal radius,
Column.
32 years male with 1 year 4 months old closed middle third shaft fracture of left tibia, sir, with implant in situ. Restriction of movement was present, sir. He can't completely do flexion, sir. And the proximal screws are not in the.
You can't flex completely.
Completely.
Why?
The proximally nail was not submerged in the bone, sir. And
Probably it is impinging on the ligamentum patella and causing
yes, sir.
undue pain, which is restricting the movement.
No, it's- and we have done implant removal, sir.
Has it improved after removal of the
Yes, sir.
Yes, sir. Flexion is improved.
Flexion improved.
Improved, sir.
60-year female with the intertrochanteric fracture of left femur, sir. So Biden Griffin type 2. We have done close reduction internal fixation with PFNs.
Use a long nail. The short nails are failing, so probably you should use a long nail.
Case for discussion, sir. Ramesh, 21 years, male with 3 weeks old, closed distal and fracture of left humerus, sir. And these are the CT images, sir. It was intercondylar extension is present, sir.
So describe the CT, plain CT. How many?
Attempt of a callus was present, sir. And it was intercondylar extension, and it was rotational display, sir.
Is there articular comminution? Is it C3 or C2?
What is what is the club? Look at the plain CT, you get more information.
In the elbow, usually there will be intermediary fragments. See the articular comminution.
And you put the CT other way around, have you? Upside down. So completely comminuted. Where is the articular surface of the distal humerus? Can you see? Not again. Look at this one, plain one.
Yes, sir.
Where is it? Can't see properly.
Yes, sir.
So badly comminuted. Both
Yes, sir.
columns comminuted. And you said some callus is there. 3 months old.
3 to 4 weeks, sir. There is no proper history, sir.
21 days old.
21 days.
Yes.
21 days, would you expect callus? Callus?
No, sir. There is no proper history of by the patient, sir.
Massage?
Yes, sir. Massage.
See, there is already faint woolly shadow on the medial column,
Yes, sir.
bridging the distal shaft and the metaphyseal area.
Yes, sir.
Might be myositis.
Is it closed or open?
Close, sir.
Closed. No wounds.
No ones.
Swelling? How much is swelling?
Swelling present, sir.
Clinical picture you have taken? Not taken?
Not.
So metaphyseal comminution is there, articular comminution.
Yes, sir.
So what do you want to do? What is the principle?
Support on the both sides.
No, what is the principle? What do you want to do? What is you want to achieve?
Principle of treatment of intra-articular fractures.
What is your goal?
Joint stability and range of movement, full range of movement.
So you want to get good range of movements by achieving good anatomical reduction and stable fixation. So how are you going to, can you get anatomical reduction?
It's difficult, sir.
Why difficult?
Intra-articular comminution and old fractures.
Can you leave it like this?
No, sir. No, sir.
So you should, there's so many people, what was the mode of injury?
Fall from bikes. Bikes are directly on the elbows.
Very sure.
Directly on the elbow.
Directly on the elbow, sir.
Direct injury.
Direct injuries.
Significant injury. This is a 21-year-old.
Yes.
No other medical problems?
No other medical problems.
So you want to achieve reasonable anatomical
Reductions.
and reasonable stable fixation. Anybody? Anybody wants to leave like this? So what was done?
Yet to do, sir.
Yet to
Oh,
do,
you
sir.
want to do? Okay.
Yes, sir.
Probably it looks very bad. Sometimes looks very bad on the X-ray, but when you open, you may not be that bad. But the whole look at the intra-articular fragments. Probably you should get a CT for this one. Intra-articular CT scan is done.
Yes, sir.
Done. Okay. Yeah, forgotten. See intra-articular. Can you identify the intra-articular fragments? How many are there? So there are two major intra-articular fragments, as you can see, and in between there is a combination. So if you can get to those in line without compression, you should not compress those two distal fragments of compression screw, otherwise it will get very crumbled. So try to preserve restore the trochlear notch. Then probably neutralization. Plate both sides.
Posture ulnar osteotomy. Yes, sir.
Okay.
So, this is for discussion, sir. 74-year female with 1 month old closed tibial plateau fracture of left tibia. Is a slab applied is elsewhere, sir. Then came here after 1 month with this.
So what you want to do? 74.
Yes.
So what do you want to do?
Can consider TKR.
What kind of TKR? Can you do primary TKR? Can you use primary implants? Or do you need special implants?
Special tibial.
You need a
Tibial
tumor process. Probably you may have to replace the proximal tibia.
Tibias.
I think that may be the best option because she has got osteoarthritis some degree, and 74. You're not going to difficult to fix it and okay. Anybody?
1 month.
She's not
No.
So 1 month may not be 1 month because it will be like previous one. The history may be longer than what. Okay, go on. Done.
Yes.
So did you counsel them for treatments? You should never promise 100% results. Warn them that they will end up some degree of, not some degree, good amount of stiffness, elbow and this one, and some degree of pain. Okay.
Thanks.
Thank you, sir.
Thank you, sir.
Anything else? How many cases are pending? Unit 1?
5, sir.
5 cases. 5. 2? Unit 2? There's nobody in it.